World Hepatitis Day, and for the first time the World Health Organization is basing its activities for the day outside Geneva. Instead, it picked Cairo. That's in recognition of the challenge Egypt is facing with the virus and the steps the country is taking to deal with it.
Egypt is a country that has a major public health problem with hepatitis. There is about 7% of the adult population between 15 and 59 years old that actually have chronic hepatitis C, so that is a substantial issue. But Egypt is at the same time one of the champion countries, I would call them, that have started to take this very, very seriously.
Infection rates have dropped from 10% in 2006 to a record low, but Egypt's goal is far bigger. It's determined to stamp out new infections.
Not directing our efforts only for treatment or for raising the cure rate. We are looking for a sort of eradication of the disease. And to eradicate the disease, we need too much time, we need too much effort, and definitely we need a lot of awareness campaigns for that.
Egypt has an estimated 15 million hepatitis C and B patients, but less than 10% are aware they're infected. That is a major factor in the rate of new infections, around 150,000 every year.
Excluding drug abusers, the virus is transmitted mainly through dentists or other barbers or long time ago through blood transfusion. I urge the Health Ministry to intensify their inspections on dentists because they are the main source of spreading of the virus in Egypt.
The government is planning to provide free treatment to 1 million patients. For those who can't afford to pay, the government has arranged for pharmaceutical companies to provide drugs at 30% of their international price. From awareness to interrupting the infection cycles, Egypt has announced a 7-steps plan to put an end to hepatitis within 7 years. The government's efforts has made Egypt a role model in facing the virus and a reason why the WHO has decided to hold the celebrations of the World Hepatitis Day for the first time far from its headquarters in Geneva. Adel, Mahrouky, CCTV, Cairo.